Hello. Today I'd like to present a video webinar on the importance of radiographic imaging in trigeminal neuralgia. So why do we emphasize the importance of radiographic imaging, specifically MRI scans in trigeminal neuralgia? And there are several reasons for this. The first is that radiographic imaging can help determine if there is an anatomic explanation for the pain. So is there a physical explanation for the pain that the patient is having? In the present day, we use MRI scans, and prior to MRI scans, the trigeminal nerve could not be very well visualized. CT scans and regular plain X-rays don't show the trigeminal nerve. Now with MRI scans, and specifically with specialized MRI sequences, which I will talk about, we can see the trigeminal nerve from several different angles. And this can help determine if there is a vascular compression syndrome. And a vascular compression syndrome is a blood vessel pushing on the trigeminal nerve that is the cause of the pain. So the first slide I want to just show you is what's called a CT scan or CAT scan of the head, and why it's typically not useful to show the trigeminal nerve. So on the CT scan, the trigeminal nerve would be right about here on the right side and right about here on the left side. But it's difficult to visualize the nerve completely on the CT scan. It kind of blends in with the background of the rest of the brain. So CT scans are really typically not useful in terms of determining whether or not there is a anatomic structure problem on the trigeminal nerve. So MRI scans, as I mentioned, are the best ways to determine whether or not there is some physical problem with the nerve itself. And there are very specific sequences that are the most ideal sequences. And the reason why these sequences are important is that if the patient obtains an MRI scan that doesn't have these particular sequences, we may not have the best pictures of the trigeminal nerve. So let's talk a little bit about these sequences. The best sequences, if you're talking about a General Electric or GE MRI scanner, is called the Fiesta sequence. And Fiesta stands for Fast Imaging Employing Steady State Acquisition. The name is not really important, but the term Fiesta should be kept in mind there. If your MRI scan is being done on a Siemens scanner, Siemens is another large company like General Electric, it's called the CISS sequence, or Constructive Interference in Steady State. So a CISS sequence on a Siemens scanner. Both of these type of scans give high resolution of the anatomy around the trigeminal nerve, and I'll show you some examples. So here's an example of a MRI scan. This is a Fiesta sequence, and here's the trigeminal nerve on the right, and here is the trigeminal nerve on the left. And in both of these nerves, we can see a small blood vessel. In this case, on the left, here's the blood vessel curving into the nerve there. And on the right, there's a blood vessel perpendicular to the trigeminal nerve there. So you can see clearly on these scans, both the nerve as well as the blood vessels pushing on the nerve. And this is why these specialized sequences are very important, because they give us a lot of insight into what is going on around the trigeminal nerve. Now, this is an axial view. It's a horizontal view through your brain. So here's your right eye, here's your left eye, here's your left earlobe, here's your right earlobe, and here's the back of the head. So that's the anatomy there. We can see that the trigeminal nerve is located directly deep within the center of the brain. This is called a coronal view. This is still a Fiesta sequence. And in a coronal view, we're taking a vertical slice through the head. So the top of the head would be up here. Here's the right ear, and here's the left ear, and here's the bottom of the brain is right here. And we can see this is the trigeminal nerve on the right, and here's the trigeminal nerve on the left. And again, you can see a blood vessel touching the trigeminal nerve on each side here. The last view that we like to look at is what's called a sagittal view, and this is commonly known as a profile view here. So the front of the patient's face would be out here to the left, The back of the head is here to the right. The top of the head is toward the top of the image here. And we can see in this particular view here, there's a trigeminal nerve. It's this gray line right here where I'm pointing with my arrow. And there is a blood vessel that's touching the trigeminal nerve on the top there. So you can see how these Fiesta scans are very important because they show us the anatomy of the nerve from 3 different angles, and they can clearly show us whether or not there is a blood vessel that's compressing the nerve. So MRI scans, they tell us the number of blood vessels. In some cases, it can be more than 1 blood vessel. And MRI scans can also tell us in some cases, not always, but in some cases, the type of blood vessel. And by type, I mean an artery versus a vein. This is important because artery the patients with the artery pushing on the nerve have better outcomes with microvascular decompression than patients with just strictly a vein. And then also the size of the blood vessel can be easily identified on the MRI scan. And I'm going to show you some pictures of small blood vessels and large blood vessels. So this is a MRI scan. Again, it's a Fiesta sequence. And this is an example of just 1 blood vessel pushing on the nerve. So the left trigeminal nerve is right here. This is the brainstem. This is where the trigeminal nerve comes out right here, and it travels forward up to this region where it then goes outside of the skull to the face. But there's a single blood vessel crossing the trigeminal nerve shown here. So this is an MRI scan example of a single artery. And I'm going to scroll through 3 pictures, and you're going to actually see the artery moving along the nerve. So there's the nerve here, and you can see the artery there. So again, you can see the artery crossing the nerve right there. And as I slide through the sequences, we can see the artery impacting the nerve. Here's an example of a trigeminal nerve that has actually 2 blood vessels pushing on it. And this is, I'm going to be pointing to the right trigeminal nerve, this side, that's coming out of the brainstem right here. But you can see 2 blood vessels, 1 here and 1 here, both of which are touching the trigeminal nerve. So the nice thing about the detail of this MRI scan is that we can see, even before doing any type of microvascular decompression surgery, you know, where the blood vessels are located relative to the nerve and how many we should be looking for. This is an example of a large blood vessel, a large artery here. You can see it, there's this black curved line, and you can see this blood vessel is much larger than the other blood vessels I showed you in the previous slide. So this is important because when you do a decompression, you want to make sure you understand what you're going to be seeing when you get in there. You don't want any surprises. And in this particular case, this was a patient of mine where we knew before we did the microvascular decompression that we were going to find a large artery when we got in there. So MRI scans help determine the pathology if there is a blood vessel compressing the trigeminal nerve. We don't do MRI scans only to look for the blood vessels. We do MRI scans just to make sure there are not other less common causes of trigeminal neuralgia. And I want to just briefly show you some examples of less common causes of trigeminal neuralgia that actually show up on MRI scans. So other things besides a blood vessel that can push on the trigeminal nerve, you can have a malignant tumor, like a cancerous type of tumor. You can have a benign tumor, a non-cancerous slow-growing tumor that pushes on the trigeminal nerve. You can even have inflammatory disorders such as multiple sclerosis that can cause problems by irritating the trigeminal nerve or the nucleus of the trigeminal nerve. So this is an example of a benign tumor. It's called an acoustic neuroma. And in this case, I showed 2 slides here. This is the MRI scan with contrast. You can see the acoustic neuroma has this kind of triangular shaped white structure here. This is the tumor. Now, when we look at the specific Fiesta sequences, again, these are the sequences that are designed to show us the anatomy of the specific nerve. We can see the trigeminal nerve right here. It's this black structure running up and down in the image. And here is the acoustic neuroma tumor. It's this gray circle here. And what we can see on this scan is that the tumor is pushing on the trigeminal nerve right as it starts coming out of the brainstem here. So the tumor is being pinched there, and that pressure on that trigeminal nerve is what caused the pain in this patient. So the way I treated this patient is I removed the tumor and took the pressure off the trigeminal nerve, and the patient's pain went away. Here's another patient. This patient has a meningioma, and a meningioma is another benign tumor. This is the meningioma shown in this white structure here. And similar to the previous tumor I just showed you, in this case, the patient presented with severe face pain, difficulty eating, was losing weight because of the pain. And when I looked at this scan, I could see that the tumor was pushing on the trigeminal nerve. It's direct pressure of the tumor on the trigeminal nerve. And so was not a blood vessel problem or blood vessel compression, it was a tumor compression. And so the way that I manage this patient is by, again, removing the tumor and getting the pressure off the trigeminal nerve. And this patient had complete resolution of their face pain by treating the tumor. This is an example of a metastatic tumor or cancerous tumor. This patient had lung cancer, and lung cancer can spread around the body. And in this particular case, the trigeminal nerve is shown here as this gray line. But if you look very carefully at where I'm pointing to with my marker, there is a brighter spot in the trigeminal nerve, a brighter white oval in the trigeminal nerve. And that's actually a small cancer tumor that spread from the patient's lung up to the brain and just happened to decide it was going to land and grow in the patient's trigeminal nerve. So this patient developed face pain secondary to this cancerous tumor on their trigeminal nerve. And I treated this patient with some special focused radiation using a machine called the CyberKnife. And that allowed us to kill the tumor and alleviate the patient's face pain. So I mentioned that you can have inflammatory processes, or in this case, multiple sclerosis. It's an autoimmune disorder where your immune system attacks the parts of the brain, specifically the lining of the brain. And in this case, this patient developed a multiple sclerosis plaque or multiple sclerosis active lesion right where the trigeminal nerve comes out. And so this patient developed trigeminal neuralgia. So again, you want to make sure there's no surprises if you're going to consider doing the surgery, and this is one of the reasons why we do the MRI scan. So let's talk a little bit about the concept of vascular compression. During the study of the MRI scan, we understand there's a large variation in anatomy from one patient to another. It actually turns out it's very common for blood vessels and nerves to be touching one another inside a human skull. And the vast majority of patients that have blood vessels touching nerve will not have any face pain. But the majority of the time, again, you get an MRI scan, let's say for some other reason, headaches, you can see the blood vessels touching the nerves, and those patients don't have any problems at all. But in some patients, the interaction of the blood vessels and the nerves cause the nerves to be irritated or injured, and this can be because of direct pressure on the nerve. It may be from the pounding or the pulsation of the artery with each heartbeat, but in any case, the nerve or the outer protective coating of the nerve gets injured, and this causes the nerve to actually fire and give off pain signals. So this is a little cartoon showing the artery compressing the nerves, which are this black structures here, and it's actually injuring the coating of the nerves, which causes the pain. This is a picture from the operating room that shows the nerve as white here, and you can see the blood vessel coming up, and it's indenting the nerve, and it's this pressure and indentation on the nerve that's causing pain. And this patient also had a second blood vessel down toward the bottom of the screen that's compressing the nerve there. Next, I'm going to show you a video of one of my patients, which had two arteries touching the nerve, and we're going to decompress both arteries. Okay, so this is the video, and during the video, a couple things to point out. I already have one cushion in there. You can see that's this white cotton ball structure. That's decompressing one of the arteries right here from the nerve. So I already have one of the cushions in place, and I'm going to demonstrate putting the second cushion in place. Notice that even though this is live surgery, there's absolutely no bleeding. If you do these surgeries frequently and you develop skill in doing the surgeries, you can get in and out and do the surgery with very little blood loss. You see how clear everything looks under the microscope. We're doing this under the microscope to give us a maximum magnification. So along the this part of the nerve here, there's another blood vessel at the top here, and I'm going to place a second cushion between the blood vessel and the nerve. So the first thing we do is we take the cushion, we place it close to the nerve with some microforceps, and then I'm going to use a series of microdissectors to gradually place the cushion in between the nerve and the artery. And this is what decompresses the artery off of the nerve, and this is what alleviates the face pain. Once you get the blood vessel off of the nerve, then the nerve actually has a chance to heal and recover, and that's what alleviates the pain as well. So we're tucking the cushion in between the nerve and the blood vessel, and it decompresses the nerve. So to summarize, MRI imaging is critical in the workup of patients with trigeminal neuralgia for the reasons I've shown. It tells us if there are blood vessels compressing the nerve as a cause of trigeminal neuralgia. And if that is the case, it allows us to see the number of blood vessels, the size of the blood vessels, and the location of the blood vessels with respect to the nerve. Also, the MRI scans allow us to rule out any tumors or multiple sclerosis or any other less common surprises that may be the cause of trigeminal neuralgia pain as well. And the take-home message is that it's very important if you're obtaining an MRI scan to evaluate for trigeminal neuralgia that you either have a Fiesta or CISS sequence done, because these are the key sequences that show us the anatomy around the nerve and tell us if there are any blood vessels involved. So I want to thank you for your time and attention. Hopefully this webinar was helpful in explaining how we use MRI scans to evaluate and manage patients with trigeminal neuralgia. Thank you.